But I have a story, and my story is one that I think can be related to by many people. You know, a story as a black man trying to negotiate white spaces, knowing the stereotypes that people have about me, knowing that people feel like you don't belong, you are simply a product of affirmative action. These are the burdens that people of color bear in these types of spaces. And so I have a story, and my story has really informed my entire sort of professional trajectory. And all the research that I do is based on my experiences as a little black boy from Pilot Mountain, North Carolina, being in spaces where he was told, you don't belong. And I've been fortunate enough and blessed enough to make a career out of it. And so thank you for, so thank you for inviting me, and let us begin. Okay. So the topic that I've chosen to present is perceived discrimination, imposter phenomenon, and the mental health of high-achieving students of color. Let's see if I can get this right. Oh, good, we work. So just if you'll indulge me for a moment, I'm going to just talk a little bit about research. Perceived discrimination. Perceived discrimination is the perception of negative behavior toward a person based on negative attitudes one holds towards the group to which that individual belongs. Now, there are some people in the field who get upset with the terminology, perceived discrimination. They believe that the term itself sort of slights the actual real lived experiences of discrimination. And that's not, you know, in psychology, that's certainly not the intention. The intention is simply to communicate that as a discipline that studies individual differences, that you can have one behavior or one event and two individuals sort of experience it differently. You know, one person might experience it as, you know, an example of discrimination. Another person might experience it differently. Or they may have a different attribution to try to explain or understand that behavior. But certainly, when we use the term perceived discrimination, we are not in any way trying to marginalize the fact that people of color have real lived experiences of discrimination. So many studies have linked perceived discrimination to health and mental health outcomes, including depression, anxiety, psychological distress. Hypertension has also been self-reported and is a correlate of perceived discrimination. Now, African Americans, of all the groups, African Americans report the highest level of discrimination of all ethnic groups, and they appraise discrimination as more stressful than most ethnic groups. Now, to be clear, all ethnic groups report perceived discrimination, and that's well documented in literature. But consistently and repeatedly, African Americans tend to report among the highest levels of perceived discrimination, which is important to note. Now, the cumulative negative impact of perceived discrimination and racism on the psychological and physical well-being of African Americans, again, was documented. And, you know, when people sort of hear this information, they wonder, is it really that bad? I mean, seriously, like, you know, you people of color, you're always complaining about how oppressed you are, and yeah, it really is that bad. Granted, it's not 60s bad. I mean, you know, we're not getting hosed down, but, you know, in its own ways, we're still catching hell, all right? A recent University of Georgia study linked racism to a greater risk of diseases such as hypertension, heart disease, diabetes, and stroke, among others. Another study found that among African Americans, that perceived discrimination can lead to long-term substance abuse problems. And individuals who perceive themselves to be victims of racial discrimination are also much more likely to smoke. Now these are, you know, for any sort of methodological purist out there, you might say, well, these are simply correlational studies. You know, these are not experimental studies. You do not have an experimental group or a control group. You cannot say definitively that perceived discrimination directly causes these outcomes. No, you can't. But when you have hundreds of studies that show a correlational sort of effect, I think one can reasonably conclude that these things are bad for us. So one study found that African Americans between the ages of 19 and 25 who experience stress from racial discrimination are more likely to experience depression and lash out in violence. And so a lot of theorists of depression, when they sort of talk about anger, they really sort of conceptualize anger as really internalized depression that then sort of is externalized, you know, in ways that are perceived to be aggression. Another study found that 18% of African Americans who perceived discrimination reported higher levels of emotional or health-related problems. So you're seeing the theme here, I hope.
Yes.
Racism and perceived discrimination are bad for your health. Did anyone not know that? If you don't learn anything else from my talk, please understand this. And it is no surprise that African American students perceive more discrimination than other students because their experiences suggest that they do, in fact, oftentimes experience more discrimination. That's just a sad reality. And again, when I say that, I want to be careful and respectful. This is not sort of a my oppression is greater than your oppression sort of spiel. I mean, it really isn't. All individuals of color have it bad. The LGBT community has it bad. Any group that's not part of the dominant majority experiences discrimination. And so I want to make sure that you hear me say that. But in the studies that I'm reporting, what is repeatedly sort of found is that African American students tend to perceive even more discrimination compared to other groups that report a lot of discrimination. That's all that I'm saying. And on campuses of predominantly white institutions, African American students experience more negative experiences with faculty, more racial conflict, and more racial harassment than white students, okay? So perceived discrimination focuses on external factors that impact the individual. That was happening in the environment that's occurring from other people that's impacting the individual. Now, what about more internal psychological factors that affect the individual? The impostor phenomenon is one such factor. And the impostor phenomenon is the experience among academically or professionally successful individuals of feeling like intellectual frauds. Now, I've got a lot to say about that, but where does this notion come from? Now, this is one of those constructs that actually comes out of clinical experience. So Pauline Clance, psychologist in Atlanta, Georgia, was working with mostly white women. And these were incredibly successful white women, women who had PhDs, women who were very successful in their various professional endeavors. These were students who were high achievers, all phenomenally successful. And yet, in her clinical work with them, she found that there was this theme that continued to emerge with them. This theme was that these women did not believe that they were really intelligent. In spite of all that their accomplishments would have suggested, they somehow did not really believe that they were intelligent. And they believed that they had, in fact, fooled people. Now, there's some interesting, notes here that I took as I was preparing for this talk. So some of them said, even though they had been accepted to some of the best graduate schools in the country, they said, you know what, it was really a mistake. I don't know how I got accepted. They must have, maybe mistaken my application with someone else's application, but if people really knew me, they would see that I don't really belong here. Some of them said, my abilities are simply overestimated. I know I'm getting all of this feedback that I'm so smart. I'm not really as smart as I appear to be, right? And so they kept seeing these types of themes occur among the women. And one of the things that they sort of, that Pauline Clance and her colleagues sort of talked about was, where does this come from? And so they traced it back to early family dynamics. Right? And they said that there are two family dynamics that are primarily responsible for these sort of imposter feelings. The first dynamic is the young girl who is smart, but she has other siblings, usually male siblings, and the parents are always telling the male siblings, you are smart, you are very, very intelligent. While the young girl is told you have good interpersonal skills, you're very sensitive, but never getting affirmed for being smart. And so at some point, the young girl begins to really internalize, well, maybe I'm not smart. Maybe I'm just more of a people person. Maybe I'm more of a nurturer, all right? So that's one family dynamic. The second family dynamic is actually on the opposite end of the spectrum, where the young girl is told, you are brilliant, you are a genius, you are smart, you can do anything. And here's this message repeatedly. But at some point, she encounters something that she actually can't do or is not particularly good at. And so there's this tension. Well, my family has always told me that I can do anything, but maybe that calculus, I'm not so good at that calculus. And so I'm really an imposter. Like, people think that I'm very, very smart, but I'm really not as smart as they think that I am. So these two sort of family dynamics, they sort of found to be the contributors to these feelings of imposterism. And so being high in the imposter phenomenon has been linked to symptoms of depression, has been linked to generalized anxiety, and has been linked to low self-esteem. Oh, 5 minutes, ooh. I get to talking, and okay, let me hurry up here. So, all right. And so, but there has been really very little research done with students of color. In fact, when I came across this line of research, I was fascinated. And the first thing that I thought was, wow, this is my experience. And I think this is the experience of many students of color. But there was very, very little research that was done out there. So I published what I believe to be one of the first or only studies applying this construct to students of color. But there needs to be much, much more done in this area. And so looking at both perceived discrimination and the imposter phenomenon, I am interested in trying to determine how these feelings impact the mental health of high-achieving students of color. So I know I have a couple of minutes left, so I'll try to get through this. And so the purpose of this study was to look at the degree to which both perceived discrimination and imposter feelings predict mental health in a sample of high-achieving students of color. I hypothesized that perceived discrimination and imposter feelings will predict both increased anxiety and depression amongst students of color, and that perceived discrimination, I thought, would be a stronger negative predictor of mental health than imposter feelings. So in this sample, and for those of you who actually engaged in sort of collecting data, you'll see that this is pretty impressive because you don't oftentimes get a sample with such an ethnically diverse and representative group of students. 108 African-American students, 103 Asian-American students, 111 Latino students were recruited on a predominantly white campus. You can see the gender breakdown there, recruited from, you know how we do it in psychology, subject pool, using Qualtrics. We use two instruments. One is the Clance Imposter Phenomenon Scale. This is a 20-item scale that measures feelings of being a fraud or an intellectual phony. Some of the items include, I can give the impression that I'm more competent than I really am. At times, I feel that my success has been due to some kind of luck. Sometimes I'm afraid that others will discover how much knowledge or ability I really lack. All right? So if you endorse these items, then you have high feelings of imposterism. And then there was the Perceived Discrimination Scale, which is a 10-item scale used to measure everyday discrimination. Sample items include, you are treated with less respect than other people, you are called names or insulted, people act as if you are not smart, and people act as if you are dishonest. And then there was a mental health inventory, which is an 18-item scale that measures depression and anxiety, among other things. And it starts with the STEM. During the past 4 weeks, how much of the time did you feel depressed? Have you been a nervous person? Have you felt downhearted and blue? Were you able to relax without difficulty? Right? So this was our outcome. And I didn't want to bore you with all the statistical analysis, so let's just get down to sort of what did we find? We found that there were significant differences in perceived discrimination and imposter feelings. African-American students reported significantly higher perceived discrimination than both Asian-American students and Latino students. But surprisingly, at least to us, Asian-American students actually reported significantly higher imposter feelings than African-American and Latino students. Now, this is a second data set that I have, so that in my first published study, we had the exact same finding. And so my research team went into this assuming that African-American students and Latino students would actually be among the highest in imposter feelings. But that wasn't the case. It was actually Asian-American students. And if this was sort of like a interactive thing, I would ask you, well, why do you think that is the case? And maybe you have some...
Model minority myth, yeah.
There you go. Model minority myth. At least that's what we sort of speculated. Now, in terms of predicting depression, for the African-American sample, perceived discrimination actually did not predict depression. Only imposter feelings predicted depression. But with the Asian-American and Latino sample, neither perceived discrimination nor imposter feelings predicted depression, which was surprising, to say the least. But that was just one of our outcome variables. The other was anxiety. And with the African-American sample, both perceived discrimination and imposter feelings predicted anxiety. And between those two, imposter feelings were the strongest predictor. And then with the Asian American and Latino sample, only imposter feelings predicted anxiety. So what does this mean? One, high-achieving students of color are not homogeneous. We are not a monolith. There are differences in our experiences that differentially impact the mental health outcomes. These factors also differentially impact the mental health of students of color. Imposter feelings predict depression and anxiety for African American students, at least in this sample. Perceived discrimination predicted anxiety for African American students, and imposter feelings predicted anxiety with Asian American and Latino students. So in this sample, it appears that imposter feelings are a stronger predictor of mental health than perceived discrimination. This went counter to what we expected, because when you hear about students of color, you mostly think about, well, they probably are getting discriminated against on predominantly white campuses. Well, that is happening, but it appears that imposter feelings are even more responsible for some of the mental health outcomes than simply, or I shouldn't say simply, than perceived discrimination. So this may be because imposter feelings are more intrapersonal rather than interpersonal. And thus they are more likely to be strongly predictive of mental health than external factors such as perceived discrimination. And it may also be that on a college campus, imposter feelings may be more salient in terms of the day-to-day lived experiences of students of color than perceived discrimination. So in terms of future research and interventions, more research certainly needs to be conducted that explores imposter feelings among high-achieving African-American students and students of color, especially in predominantly white spaces, because we get these messages that we don't belong in subtle and not so subtle ways. And so how does that impact our self-concept? How does that impact our feelings of imposterism? And if it is found that imposter feelings are prevalent among African-American students and other students of color, interventions need to be conducted that counter the effects of imposterism. And this is especially the case, and I didn't share this data, but I do have data that links imposterism with GPA. Although in a manner that you might not anticipate, because it's actually the case that the higher you are in imposter feelings, the higher your GPA is. But it comes at a cost, a mental health cost. And with that, I thank you.
Thank you.